Next presenter is Dr. JYOTHI KRISHNAN. Her paper is on to compare the utilization rate of hospital and voluntary retrieved cornea in an eye bank in Kerala.
Very good morning to everyone. And my study is to compare the utilization rate of hospital and voluntary retrieved cornea in an eye bank in Kerala. So, hospital cornea retrieval program. HCRP focus on hospital-based death, encourages eye donation using a combined method of motivation and grief counseling. And what are the advantages? There's readily available medical history, availability of younger tissue, lesser time spent in cornea retrieval, and cost effectiveness. And voluntary eye donation. Voluntary eye donation is the act of pledging to donate one's eyes after death. So, the Eye Bank Association of Kerala established in Nittival Hospital, Angamali in the year 1970. Even though we started HCRP, voluntary is the whole strength of our eye bank. So, from literature, we found that the better quality tissues are from the HCRP, and most of the studies of 1 year duration. So, we analyzed our data of 4 year and 3 months data to assess our utilization and what are the post-COVID trend in eye donation in Kerala. We have 8 collection centers and around 300 registered volunteers. This is a retrospective record based study, and duration is from the 2020 January to 2024 March. All the records of the cornea retrieved during the study period were analyzed. We stratified the corneas into HCRP and voluntary, and the following variables are studied, like demography, suitability of the tissue, type of surgery and utilization, and causes for rejection. The data analyzed with the SPSS software and a chi-square test was used to analyze the all categorical variables and all categorical variables expressed as percentages. Results: total 5,081 corneas were assessed. In this, 3,021, 59.4% in voluntary, and 1,880, 37% in HCRP group. The age distribution of donors shows that most of the donors belongs to the age group of 60 to 80. When we compare HCRP and voluntary group, we can see that the most of the younger tissues are from the HCRP group, and we can see that in 41 to 50 years of age, almost double the amount of corneas are collected in HCRP. And a main predominant pattern is seen in HCRP and voluntary group. The table shows total year-wise utilization of the cornea, and we can see that in 2020 and 2021 there is a fall in collection. Even though there is a fall in collection, there is better utilization of the available tissue can be seen, almost 76% and 82.1% of tissue. And these are the comparison of utilization between HCRP and voluntary group, and we can see that there is a more percentage of the tissues are utilized in HCRP group. So, after retrieval, we assess the tissue for its suitability for further surgical procedures. In SCRP group, 1,576, almost 80% of the corneas are suitable for further transplantation. But meanwhile, only 60% is not suitable in HCRP group. In voluntary group, almost 42.6%, 1,360 corneas are suitable, but 1,838, 57.4% tissues are not suitable for surgical transplantation. These are the surgical utilization in HCRP in voluntary. In HCRP, almost 60% of the tissues are utilized for optical transplantation, and that 44% is for penetrating keratoplasty, 17.1 for DSEC, and 7.9 for anterior lamellar keratoplasty, and 30.8% tissues are utilized for therapeutic keratoplasty. While in voluntary group, 28% is utilized for the optical purposes. In this, 24.6% for penetrating keratoplasty, 3.3% for DSEC, and 0.3% for anterior lamellar keratoplasty, and 14.15% is used for therapeutic keratoplasty. So, we assess the corneas tissues as wall globe and corneal button, and from the graph we can see that 95.7% of the corneas retrieved in HCRP group as corneal button. Only small percentage is retrieved as wall globe. But in meanwhile, in voluntary group, almost 50% of tissues are retrieved as wall globe and corneal button. And most of the wall globe in the voluntary group are used for surgical purposes, research purposes. And what are the reasons for not using a tissue for surgical purposes? We found that there is very old age, foreign body, infiltrate, cancer metastasis, medium color change, and scar suggestive HSV keratitis and serology. And most of the discarded tissues belongs to the voluntary group. And we also assess the expired tissue, And in 2,839 suitable tissue, only 12 tissues are expired, and that is 11 from the HCRP group and 1 from the voluntary group. So my conclusion is, our study is the first ever iBank study from Kerala with a big data analysis and a duration of 4 years and 3 months. And we found that the younger tissues and suitable tissues and transplantation is more in HCRP. So from the slide, we can see that during 2020, 2021, when the India and the world were suffered from the COVID pandemic, even though the retrieval rate was so low, the available tissues are better utilized, 76% and 82.1%. And that data is compared with the data from the one other state in India, even with the international data. And after COVID, we can see that there is a rising pattern with better utilization and retrieval. So it shows that there is a effective iBanking was done during COVID and are still continuing. And when we compare with the studies from the other state iBanking study, we can know that Kerala is a small geographical part of India with a small population. Even though our population is so small, the results are comparable. So one study done by Dr. Narmada Sharma in 2018 in National iBank of India with a 40 months of duration, the results are so comparable. So our iBanking rate is, our iBanking system is so effective. So interpretations, we have to reach out to all multi-specialty hospitals and ask them to link with our iBank, and FT communication with the corneal surgeons, and various public awareness program and voluntary appreciation program have to be done. So let your eyes live on. Don't destroy it. Donate it. Thank you.
Your utilization, the lack of utilization you showed, no, the slide is, there's a different scale for VFS and also HCRP.
Yes,
The scale is, one scale is,
Ah.
so if you look at the graph, it looks similar, but actually it should not be. The
Uh,
scale
so,
you have put
the
is,
total number is different, sir.
yeah, so
sir,
you should not represent it like that, because if
Okay.
anybody looks at it,
It's
it looks
almost
like
same. Okay, sir.
so that's a lot of discrepancy. I mean, there's a difference, gross difference, the scale,
Yeah, sir, but the numbers are different. So from the number, it's
not this, the non-utilization. Yeah,
this one. This one.
no, no,
The
another one.
the tissue they used for surgical, research
have to-
purposes.
So because there's a lot of resources are being, wasted in retrieving those eyes and then not utilizing it.
No, sir, we
So,
have to create a
yeah,
public awareness. So
what-
even one person is voluntarily they are willing to donate their eyes, we have to promote.
No, that is true, but that is what is happening, but still you're not able to utilize it.
Yeah, we can use it for research purposes, sir, like various wet labs, like PG training, and even for research purposes, we can utilize that. It's not wastage.
Oh.
Thank you.